Welcome to the Heart and Chest Matters podcast, where we're delighted to be joined today by our Tissue Viability Nurse Consultant, Julie Tyrer, and we're going to be talking about the vitally important issue of moisture-associated skin damage, as well as an exciting new initiative and awareness day for 2022. Morning, Julie. Thanks so much for coming on. I guess this is a little bit different from what you'd usually be doing on a Tuesday morning.
Yeah, it really is. Yeah, I should be in clinic right now, but took time out to be here.
So I was hoping that you would start by just explaining a little bit about your role. So what is tissue viability? I'm guessing some people may not know exactly what it is.
Well, tissue viability it covers a broad spectrum of skin and wounds. So we're really in place to provide support to staff and patients who are admitted with or develop while we're here any wound or skin condition. So what we see is people admitted with chronic wounds such as leg ulcers, diabetic ulcers, surgical wounds and skin conditions. And of course when patients are particularly in hospital, they will have developing surgical wounds and unfortunately at times pressure ulcers or moisture associated skin damage or other skin conditions. So our role is really to provide that support for complex wound management and also a big focus on prevention of patient harms, and obviously most people will consider those to be at the moment pressure ulcers and perhaps moisture damage as well.
Well, it sounds like the work that you do is quite specialised.
Yeah, it definitely requires a more expert knowledge because we're there to support staff when they can't go any further or when they're stuck at what to do. So we get referrals from staff nurses, but GPs, consultants, a whole range of MDT staff really, and we also support staff with any ongoing wounds or skin conditions they might have as well. So we're there as a support for them as well.
Okay, so from a patient and perhaps from a family member's perspective, can you try and help us understand what impact skin damage can have on them?
Well, of course, because we're looking after the patients firsthand and we spend a lot of time with them, we see firsthand the impact of wounds and skin damage. And the impact on their quality of life is something that has been researched to some degree, but there's certainly room for more. We see patients' quality of life massively impacted, particularly where wounds fail to heal, and they're living with a chronic wound for many months and sometimes longer. It stops them doing what they would normally enjoy doing. And of course wounds and pressure ulcers and moisture damage can become infected because there's a break in the skin, and with infection comes pain, discomfort, a malodour, and I imagine if we haven't had a wound or a skin condition, we couldn't possibly understand how much of a detrimental impact that has on the patients. And we do see it firsthand. Surprisingly, one of the most painful conditions is moisture damage, because a lot of nerve endings are exposed. It can be superficial damage, and it can be really distressing to actually look after a patient and to see them in that amount of discomfort.
So can you just explain a little bit more then about moisture damage? What is that?
It's an umbrella term, so it covers a range of skin damage which results from prolonged or excessive moisture. So it's often urine, faeces, which causes something called incontinence-associated dermatitis. And you can imagine that's affecting quite intimate parts of the body. So as well as the pain, the discomfort that can cause very sore, excoriated skin. It's an embarrassing condition to have as well. And the other types of moisture damage are something called intertrigo, and that's where kind of perspiration gets trapped between skin folds. And we see many patients come in with that condition, and again some who develop it while they're here. And yeah, as well as the pain, the discomfort, it's a very embarrassing condition, because it's often to patients associated with they think hygiene and skin cleansing is important, but it can be a difficult condition to get on top of and prevent. But of course prevention is always going to be better than cure.
And you mentioned it before, but what impact would it have on the clinical teams on the wards who are caring for those patients?
We had a patient on one of our surgical wards a few weeks ago, and the patient's moisture damage was quite severe. So unlike pressure ulcers, which tend to be kind of singular ulcer in one location, moisture damage kind of spreads, so it can affect much larger areas. And as I just said earlier, it kind of causes superficial damage in the majority of cases where lots of nerve endings are exposed. So that's what causes the burning sensation. Almost will feel to a patient like a chemical burn, because urine and faeces have chemicals within them. So it is tantamount to a chemical burn. The staff on the ward were visibly upset by seeing the patient in that much discomfort. And unfortunately, once the damage is done, it does take time for it to improve. And those few days while the treatments that we were using were improving the condition, it does take time. It was upsetting. The staff were clearly upset.
I know that about 5 years or so ago, you started to develop an improvement initiative called Minimise Moisture here at LHCH. So can you tell us a little bit about that, where it came from, and I guess what the improvements you've seen during that time?
Yeah. I'd have said 3, but I trust that your memory is probably going to be better than mine. But gosh, it was 5 years ago that it really doesn't seem any time at all, because I still remember us planning and implementing that campaign. It came about, we'd noticed patients coming in with moisture-associated skin damage, and we were also seeing patients develop it while they were here. And in many cases it is minor harm, but we saw a couple, only a couple fortunately, where it was really quite severe harm, and I've touched upon how distressing it is for staff. It was really distressing for us to see that, and we wanted to do something about it. So we actually launched this around about the same time, or a bit before, there was a national recommendation about it, because NHS Improvement released a document in 2018, and it was the first time there was a mention of moisture damage in there, and it was saying that trusts should actually now be capturing it and should be doing some kind of quality improvement work about it. So you're right, Matt, I think it probably was a bit before that, because I remember thinking, oh, we've already done something about that. So I had a look at all the literature that was available at the time, all the evidence around moisture damage, and from that, kind of the acronym Minimise just fell out of it, really. I think I was short of one letter, but you can always find a letter. So each letter in Minimise represents one of the key considerations that staff and patients should bear in mind. So things like identifying who's at risk, implementing a skincare regime, education. It would be a test if you asked me to name every letter here and now. But it's all readily available.
We can add the link.
Yeah.
So has it made a noticeable difference then?
Yeah, again, what we did after the campaign was develop a toolkit so that organisations, if they wanted to, could replicate it. And I learned a lot from just doing the toolkit, because I actually recognised the mistakes that we made. And one of those was really spending time thinking about how we were going to really measure the outcomes. What we did find, we had a 3-fold reduction in the number of patients who developed moisture damage after the campaign. But importantly, doing the campaign allowed us an opportunity not just to raise awareness and knowledge and skills. Education is very important, but it just allowed us to focus on a review of our products that we were using, the documentation that we had in place. We always had a standalone guideline for moisture damage, but it allowed us an opportunity to review everything, really. And now what we have as a result is a continuous monitoring system. So we continually monitor the number of instances of moisture, and we're constantly developing kind of new actions as a result of that.
So where is Minimise Moisture up to now? Because I believe there's a big day coming up, 17th of March. Can you tell us a bit about that? Yeah,
it's up to a very exciting point, Matt, and we've been working in collaboration with a company called Medline. We use one of their products. We had long before we launched our local campaign called Ultrasorb, and really as a fallout of that, we started collaborating, and they were offering support and anything else if we wanted to take the campaign further. So I think what's coming is going to be a good example of how clinicians and industry can work together to actually achieve something more than they would achieve on their own. So what we've been working on is the launch of the first National Moisture Associated Skin Damage Awareness Day, and we haven't copied, but it is akin to the Stop the Pressure Day. So the Stop the Pressure Day, which many health and social care organisations, tissue viability nurses, quality leads, patient safety leads are going to be familiar with, falls on the third Thursday in November every year, and lots of organisations participate in that day and will do kind of promotional activities of varying degrees, and then it's widely circulated on social media. So we are launching the first, hopefully, National MASD Awareness Day called Think MASD on the third Thursday in March. So the rationale for that was, if there's one for pressure, there should be one for moisture, and we're really inviting as many health and social care organisations to join us on that day, so we can align all of our activities. And if organisations want to get involved, is there an opportunity now to share those details? There is a long link, and I managed to find a shortcut. So if
we can share that link anyway.
Oh, thank you. But if organisations want to get involved, if they just type in the browser Medline NASD, the page comes up there, and what that is, it's a link to a web page, and there's a registration box, and if organisations fill that in, they'll receive a link to a digital campaign pack. So what we wanted to try and do was at least give organisations a start, because once you've got a start, you can build on it yourself, and local organisations will do different things. But what this digital campaign kit will provide is an information leaflet for staff and patients, a whole range of posters and resources, and also additional links to merchandise. So if anyone is taking a lead in their organisation, I'd encourage them to speak to the powers that be and ask them would there be a little bit of funds, because then there are some nice promotional items, pens, mugs, that type of thing, that just help engage staff a little bit better on the day. But if not, as I said, organisations will do either small events, might just be circulating information, or they'll take it really big. And as long as organisations are doing something, we think that would be really one significant step in the right direction to try and raise awareness of moisture damage. So
how does that make you feel that so many other health professionals around the country will be, I guess, building on the work that you started?
That was our intention, and I think this should be the ethos across, and it is the ethos in many organisations, is if something works well in one area, we should be sharing it, and we should be, I do all the time, you're in a meeting or a conference and you're jotting down, that's a good idea, I can work with that, and there's no point in reinventing the wheel. So I feel like the evidence that was around when we were looking at minimised moisture hasn't changed. So it still stands, which is good. So it's not kind of lost any evidence base along the way. It's there, it's ready made. If other organisations can use it, that's brilliant. It really, honestly, would make us feel very satisfied that something that we've done here can actually have any value somewhere else, and it's ultimately, if that can kind of encourage someone else or launch someone else or save someone a bit of time, then why not? Because we're all really busy people.
So we know awareness days can be really helpful, but I'm sure for you and for the rest of the team, it's not really just about one day.
No.
So what key messages would you like people to take away, things they could change, do differently, think about in their own organisations?
Well, one of the key things on the day is a call to action. So it's a call to action for staff to think about just 3 things, because you're right, it can be overwhelming. the volume of information shared on an awareness day can be overwhelming. And you're right, it doesn't just stop there. So we are asking staff to think of 3 things. So, for example, my main 3 things would be, firstly, identify the high-risk patients, implement the plan, and importantly, using the right product at the right opportunity, at the earliest opportunity rather. So hopefully staff who kind of visit us on a stand, or who we might meet as we're kind of walking around the wards on the day, we'll be asking them to think about just remember just 3 things, or even if not just 3 things, just one thing, and the one thing will be prevention. We will follow up the day as well, and we'd hope other organisations will follow up the day as well. What's very useful of a day is you can take lots of photographs, you can speak to lots of staff, and then of course we can circulate those and then just keep on it. That gives kind of the first kind of big launch platform, if you like, but then hopefully organisations will continue that momentum, because it does need change. Any change doesn't happen overnight. It requires that constant revisiting, that constant promotion, but to have a day allocated each year, as with the Stop the Pressure Ulcer Day, it gives that renewed focus across the organisation, and it gets actually the right stakeholders listening as well, which is everyone, sitting in a hospital. It's everyone. Everyone's got a responsibility and an interest in preventing skin damage.
And ultimately it's about the patients, isn't it?
Absolutely.
Julie, thanks so much for your time, and good luck with the day.
Oh, thank you very much.